So I have to say that in when I worked at another world famous medical institution in Minnesota for 12 years, I often undid a diagnosis of asthma. And one of the characteristic features was the child was on a truckload of asthma medications and it wasn't making a difference. So I'm using asthma as an example, but this can occur with any condition. Um, if the medications aren't working, it always makes me as the physician, especially if I'm the second, third, fourth opinion, sort of reevaluate the whole diagnosis. So I may annoy parents by asking them questions because sometimes they say, well, it's all in the records, but I want to hear it from them. I want to hear what they perceive, not what their doctor interprets their reporting. So I want to get it right from the parents, and if the child's old enough, right from the child. And I assemble that information, and you weigh it, and I liken it to being a lawyer, where I'm trying to build a case for or against a particular diagnosis. But one of the telltale signs is if a child is on a good amount of what I consider a good amount of asthma therapy and it's not working, then I always sort of question the whole diagnosis. And we talked earlier about cough variant asthma. Well, that's a classic example of a diagnosis that's overdone, and there are many other causes of chronic cough that should be investigated, particularly if you're on a lot of medications that aren't making a difference. Yeah, there are some medications that can cause cough. Not used very much in children. Some of the blood pressure medications used in adults can cause chronic cough. Some of the immunosuppressive medications used more often in adults with arthritis or rheumatologic conditions can cause a cough. And then you can have that's the low-lying fruit, the easy ones. There are other medications where cough can be a side effect. It's kind of my last resort. So I may do a lot of other investigations, make sure it's not the more common causes, whether it's 2, 3, 4, 5 of them. Get those off the table, and then to really prove that it's a drug-induced cough, you really have to do a trial of withdrawal. Now, for some patients, they can't tolerate removal of a particular medication, so that's not a challenge that I enter into, that I recommend lightly. But and then if you stop the suspected offending medication, the cough goes away, you should always re-challenge the patient, and if the cough comes back, then that's about as solid a case as you can make. Then it's worthwhile trying to find alternative treatment.